Middays, we are live at the Country Club of Jackson for the Sanderson Farms Championship. I know the sun has gotten a little higher in the sky, so we have a little shade cast on the set here, which is a good thing. Dr. Mary Taylor, the chair of Pediatrics at the University of Mississippi Medical Center, is our guest now. Dr. Taylor, thanks for coming on.
Thank you. Good morning.
So the Sanderson Farms Championship, of course, has raised a lot of money for Children's Hospital, Children's of Mississippi. It's a great thing the PGA Tour does across the country, but specifically here with the Sanderson Farms Championship in the capital city, I can think of no better a cause to raise money for than Children's.
Yeah, they have done a tremendous job over the last many years. They've donated about $17 million, a little more than $17 million to the Children's Hospital. And really, without their support, we couldn't have made the changes that we've made in the last few years. We have a brand new tower that was built, and we moved in 2020. And largely, the support from this championship has really made that huge difference to enable us to do that.
It's awesome. And so, how many of children from Mississippi, or I should say from a percentage of children served, the vast majority are actually from Mississippi, the patients, right? I think the speaker told us earlier a child from every of the 82 counties.
That's correct. We serve the entire state of Mississippi. You know, it's situated here in Jackson, and we have Children's of Mississippi here in Jackson, and many people think it's a hospital for just the Jackson area, but really we support the entire state. We have outreach clinics throughout the state. We have some in Tupelo, the Coast, Meridian, you know, really I think like 8 locations around the state. So we want to serve every child in the state of Mississippi and have them come to our hospital to get their specialty care. We have about 20 different subspecialists that take care of children every day, and many surgical specialists. So we do everything any other hospital in the country does.
You know, you wonder if we didn't have Children's here in Mississippi, what would happen? Parents, families, children would have to travel.
That's right. For many years, for some specific things, patients and families had to go to another state. So they'd have to go to Philadelphia, Pennsylvania, for example, to get their heart surgery, or Boston.
Yeah.
And, you know, that's a huge hardship for families to have to go out of state and relocate, even temporarily. So, you know, most people don't have the resources to do that. So we've been able to build teams of people and have all the subspecialists to provide state-of-the-art care. We have people from all over the world that, you know, trained all over the world that are here and just experts in their field.
And many of those healthcare professionals, specialists, physicians, and so forth, their services are in demand. They can go anywhere they want.
That's correct. It's really not hard to recruit people to come to Mississippi. It's a little challenging to get them to come the first time, but once they come here, they see how great it is.
Yeah.
And we have people from all over the world, really, that do all types of things, and every year we recruit more and more people. We have several joining us, usually at this time of year, July to September. So these people could go anywhere in the world, and they choose to come here to Mississippi and provide care for our patients.
Yeah.
We have a really unique situation, being the only children's hospital in the state of Mississippi. So, you know, some states have multiple children's hospitals, so it's really a unique situation to provide care for patients that wouldn't have care otherwise.
Yeah, it's totally awesome. So, new tower, right? When did it open exactly?
We moved in 2020.
Yeah.
It still feels new to us.
Yeah.
We have a lot of space within that building for future expansion.
Okay.
We have shell space for other projects that are upcoming, and we're constantly building and changing and growing. We recently moved into the new blood disorders, cancer and blood disorders clinic, and we have support from Friends of Children's Hospital, Century Club, the Sanderson Farms Championship. Those things help those kind of projects as well. So it's not just that new tower, it's all the other things that are coming.
And in fact, in 2018 and 2019, the Sanderson Farms Championship was honored and recognized by the tour as the best charity integration.
Right. That's really incredible. I mean, the PGA as you know, is a huge organization, and there are events all over the country.
Yeah.
And to be chosen for that is really a huge honor. They've done a tremendous job. They have T markers that look like chickens that are painted by the children. They have posters that show some of our patients, and many of our patients come out here and volunteer and greet people. So it's really a huge integration. We have the players have come to the hospital this week. Players' wives have come to the hospital this week. So it's really been a great connection between Sanderson Farms Championship and the hospital.
How are they received by the patients, by the children, patients, and their families when they see these professional golfers?
They are so excited to see people like this come to visit them. They're honored to have these people visit. It's really puts a smile on their face, and they're in a kind of a bad spot when you're in the hospital. But it's really a great thing that we can have that kind of support from our community and from things like this.
And that's actually as important to the healing process.
That's right.
As medicine itself, right?
That's right. We have lots of activities like that at a children's hospital, things that are kind of special and unique to being in a children's hospital. We have a new facility dog, for example, that comes and visits with children. But, you know, even those types of things are expensive to have, and so having a connection with support from events like this makes a huge difference and enables us to do those things that other children's hospitals do.
What about future plans, Dr. Taylor?
Well, we have, as I said, the Cancer and Blood Disorders Clinic was recently renovated, and we've moved into that. We're renovating the Batson Children's Tower. That is the tower that houses our inpatients, so we're renovating that to look and feel like the Sanderson Tower, so it's a kind of a seamless patient experience and family experience. We want them to have the same experience they'd have if they go anywhere in the country. So we're really attentive to having a great experience throughout the whole thing. We're building out several of our clinic areas for a new physical therapy and occupational therapy area that's soon to open, and an adolescent psychiatric unit. So we don't have a unit in this state to take care of inpatients, children that need inpatient service for adolescent psychiatry, and so that's soon to break ground.
How are we doing from just a medical technology perspective of advancing new treatments, new cures, new therapies to treat some of these childhood disorders and diseases?
Well, we've come such a long way. It's amazing. In the past several years, we've added many, many technologies. One example is a robotic surgery. A few years ago, we may have done one or two urologic procedures through a robotic approach. And in this past few years, really this past year, we've done more than 10 a month.
Wow.
So several, that kind of thing has become more and more common to do, an appendectomy, for example, with a robot.
Yeah.
So those kinds of things minimize the time they have to be in the hospital. It helps the healing faster, helps them get home and get back to their baseline sooner.
Just poking
It's
a few
amazing.
holes there, really.
Yep. That's right.
Instead of the big incision, right?
That's right.
I mean, that's the idea.
And with the robotic surgery, it's just a completely different type of thing. The surgeon obviously is still involved, but
sure.
it just is it's known to have less side effects, less length of stay in the hospital.
Are most of the children's facilities dedicated for the care of children? Are they mostly located or associated with a teaching hospital such as UMMC?
Pretty much any subspecialty, with a rare exception like some gastroenterology or allergy, but most things that have subspecialty services are associated with an academic medical center. We do teaching and research are a big part of what we do. We take care of teaching medical students, residents, trainees, and we're trying to grow the next generation of people to take care of
Well, you
children.
mentioned the GI specialty. My longtime good friend Paul Parker, of course.
He's a great supporter of our hospital.
Yeah. I mean, and dealt with very unusual
That's
cases.
right. He was the only one here for a long time, and now we have a gastroenterology division that he founded, and really we've built on what he established.
That's fantastic. So you've got some future plans to perhaps renovate the original Batson Tower. And how long has that been around? 25?
That was finished in 1998.
Okay.
So long time.
Yeah.
And it needs a little
years.
touch up and really kind of change the things, the nursing station and some of the cosmetic types of things and services for patients and families to really upgrade things a bit.
Are we running out of room on the campus there?
It's pretty tight. We fill up all the beds most of the time, particularly in the wintertime. We have a very busy emergency room, for example, and we do have a shell space for a future emergency room. We would love to build that out. That would enable us to see more patients in a more efficient way and that type of thing. We do have urgent care, for example, to see patients that aren't particularly emergencies.
I got you.
So that kind of helps offload some of the volume.
Wow. Well, real quick before we go, what about future healthcare professionals dedicated to pediatrics? How are we doing there?
We're doing pretty well. We have the largest department at UMMC, and we have 160 or so physician providers, and then we have advanced practice providers also. But we're growing all the time, adding new subspecialists, and as I said, we're training subspecialists too with fellowship programs.
Good stuff. Dr. Mary Taylor has been our guest, Chair of Pediatrics at the University of Mississippi Medical Center. Thanks for coming on.